Non-alcoholic fatty liver disease is a condition where excess fat builds up in the liver of people who drink little to no alcohol. Now you might be thinking, fat in the liver? Fat is supposed to be under the skin or around our organs, and you'd be right to an extent. A healthy liver should contain little to no fat. But in non-alcoholic fatty liver disease, or NAFLD for short, fat starts to accumulate in liver cells, and this can lead to a host of problems. There are multiple stages to NAFLD. On one end, we have simple fatty liver, also known as hepatic steatosis. This is where fat builds up in the liver but doesn't necessarily cause liver damage. It's like your liver has put on a bit of weight, but it's still functioning normally. On the other end of the spectrum, we have non-alcoholic steatohepatitis, or NASH. This is a more serious form of NAFLD where the fat buildup is accompanied by inflammation and liver cell damage. If NASH progresses, it can lead to fibrosis, or scarring of the liver, cirrhosis, which is extensive scarring that impairs liver function, and even liver cancer in some cases. NAFLD is the most common chronic liver condition in developed countries. In the United States, it's estimated that about 25% of adults have NAFLD. That's 1 in 4 people, and the prevalence is even higher in certain groups. For example, among people with obesity or type 2 diabetes, the prevalence of NAFLD can be as high as 70 to 80%. Causes of non-alcoholic fatty liver disease. The exact cause of NAFLD is not completely understood, but there are some factors that greatly increase your risk. One of the primary drivers of NAFLD is obesity. When we consume more calories than we burn, the excess energy is stored as fat. Some of this fat ends up in the liver. Think of your liver as a processing plant for fats. When it gets overwhelmed with more fat than it can handle, the excess starts to accumulate, leading to NAFLD. Insulin resistance is another key player in the development of NAFLD. Insulin is a hormone that helps our cells take up glucose from the blood. When cells become resistant to insulin, the pancreas produces more insulin to compensate. This excess insulin can promote fat accumulation in the liver. It's like your body is stuck in fat storage mode. Diet plays a crucial role too. A diet high in processed foods, added sugars, especially fructose, and saturated fats can contribute to the development of NAFLD. It's not just about the quantity of food, but also the quality. For example, consuming a lot of sugary drinks has been strongly linked to NAFLD. Sedentary lifestyle is another risk factor. Regular physical activity helps our bodies use energy efficiently and maintain insulin sensitivity. When we're inactive, we're more likely to gain weight and develop insulin resistance, both of which increase the risk of NAFLD. Other than that, genetics also play a role. Some people seem to be more susceptible to developing NAFLD due to their genetic makeup. Other factors that can contribute to NAFLD include certain medications, like corticosteroids and some cancer drugs, rapid weight loss, and some metabolic disorders. Symptoms of non-alcoholic fatty liver disease. The symptoms of NAFLD are often subtle and can go unnoticed for many years. In fact, most people with NAFLD do not experience any symptoms, especially in the early stages of the disease. However, as the condition progresses, some people may develop symptoms related to liver dysfunction. One of the most common symptoms of NAFLD is fatigue. Individuals with the condition often report feeling unusually tired or weak, even after adequate rest. This fatigue is thought to result from the liver's reduced ability to function properly and the overall metabolic disturbances associated with the disease. Another symptom is discomfort or pain in the upper right abdomen, where the liver is located. This pain is usually dull and persistent and can be exacerbated by physical activity or after eating a large meal. In more advanced cases, where the liver has become enlarged, which is called hepatomegaly, the pain can be more pronounced. As NAFLD progresses to NASH and beyond, additional symptoms may appear. These can include jaundice, which is yellowing of the skin and eyes, which indicates severe liver damage and reduced liver function. Individuals may also experience swelling in the legs and abdomen due to fluid retention, known as edema and ascites, respectively. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of non-alcoholic fatty liver disease. The diagnosis often starts with routine blood tests. Your doctor might notice elevated liver enzymes, particularly ALT and AST, on a standard blood panel. While elevated liver enzymes can be caused by many things, it's often a first clue that leads to further investigation. If NAFLD is suspected, your doctor might order imaging tests. An ultrasound of the liver is often the first imaging test used. It can show if there's fat in the liver, but it can't distinguish between simple fatty liver and NASH. For a more detailed look, your doctor might order a CT scan or an MRI. These can provide more information about the amount of fat in the liver and can sometimes show signs of advanced liver disease. In some cases, a liver biopsy might be recommended. This involves taking a small sample of liver tissue and examining it under a microscope. A biopsy is the only way to definitively diagnose NASH and determine the extent of liver damage. However, because it's an invasive procedure, it's not done routinely and is usually reserved for cases where the diagnosis is uncertain or to determine the severity of liver damage. There are also some newer, non-invasive tests being developed to assess liver fibrosis. These include specialized blood tests and imaging techniques that can estimate the amount of scarring in the liver without the need for a biopsy. Treatment for non-alcoholic fatty liver disease. The good news is that NAFLD, especially in its early stages, is often reversible. Treatment for NAFLD primarily involves lifestyle changes aimed at addressing the underlying causes. Weight loss is one of the most effective ways to reduce liver fat and improve liver function in individuals with NAFLD. Losing even 5 to 10% of body weight can significantly reduce liver fat and improve NAFLD. This usually involves a combination of dietary changes and increased physical activity. Your doctor or a registered dietitian might recommend a diet low in processed foods and added sugars, and high in fruits, vegetables, whole grains, and lean proteins. Exercise is another crucial component of NAFLD treatment. Regular physical activity can help reduce liver fat even if you don't lose weight. Aim for at least 150 minutes of moderate intensity exercise per week or 75 minutes of vigorous intensity exercise. Medications may be prescribed to manage specific risk factors and complications associated with NAFLD. For example, insulin sensitizing drugs such as metformin may be used to improve insulin resistance in individuals with diabetes. Statins can help lower high cholesterol levels, and antihypertensive medications can manage high blood pressure. For people with NASH, especially those with significant fibrosis, additional treatments might be recommended. While there are currently no FDA-approved medications specifically for NASH, several are in clinical trials. Some existing medications, like vitamin E and the diabetes drug pioglitazone, have shown promise in treating NASH in certain groups of patients. In severe cases, where NAFLD has progressed to advanced cirrhosis or liver failure, liver transplantation might be necessary. However, it's important to note that NAFLD can recur in the transplanted liver if the underlying causes aren't addressed. At the end, living with NAFLD can be challenging, but many people find that the lifestyle changes can manage the condition and lead to improvements in their health and well-being. Now we want to hear from you. Do you or someone you know have non-alcoholic fatty liver disease? What symptoms did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.